The science and history of ozone is interesting, but what's the point? I mean, how does it benefit our outcomes in the office? How does it benefit our patient's health? The truth is, ozone is ideal for use in the mouth. For example, I use ozone when doing fillings because it desensitizes the tooth I've worked on. In the last 8 years, I can count the number of sensitive teeth I've seen after doing a filling on one hand. In dentistry, we don't really understand a lot about how sensitivity occurs. There's thoughts around how much you dry the tooth during the composite, there's desensitizing liquids you use, and they were always pretty lackluster to me. It seemed like even when I did all those things perfectly, my patients still had sensitivity. Prior to using ozone, it was normal for most of my patients to have sensitivity to colds and chewing after having a filling. This alone is enough of a reason for me, for all dentists, to think about incorporating ozone into their dental practices. I mean, who wouldn't like less tooth pain after having a filling? In this way, ozone can help prevent a nerve in a tooth from dying because it's usually bacteria entering the nerve that causes the tooth to die and the patient to need a root canal. Since starting to use ozone 8 years ago, I can count the number of root canals a patient of mine has needed after doing a filling or a crown on one hand. And this includes deep cavities that have gone nearly to the nerve. If the tooth is not dead when I first see a patient, there's a very good chance I can save the tooth using ozone. Ozone also offers incredible antimicrobial support. They say the human mouth is one of the most infectious areas on earth. So we use ozone with our gum therapies and cleanings, and we use ozone when working with teeth that have a lot of deadly anaerobic bacteria, like root canals or cavitations. Before every dental cleaning, we have our patients swish and rinse their mouths for a minute with freshly made ozone water. This helps to bring down the number and types of dangerous bacteria prior to the cleaning and helps to protect the patient's heart. When you understand that most heart disease comes from the mouth and infected gums, having a safe, non-toxic way to lower bad bugs in the mouth prior to the cleaning is a real health benefit to our patients. Because ozone demonstrates a property called crawling, we don't have to force ozone gas painfully into the gums. We can place it gently at the gum line, and the ozone will travel down the root and into the gums to kill the bad bugs hiding there. It's a very intelligent medicine, and I love using it for our patients. Ozone offers an incredible healing advantage in the preconditioning or pre-surgical treatment of root canals. I always use ozone now prior to doing any type of extraction. There's been research done by a great ozone therapist named Lamberto Ray that shows that if a person has ozone introduced into tissue prior to surgery or trauma, that on average the patient will experience 50% less pain and inflammation after the surgery. Is there anyone out there who wouldn't like 50% less pain when they have a tooth extracted? And it's important to understand that ozone does not kill our cells like it kills a virus or fungus. Human cells are covered with little labels that tell ozone that they belong to you. Ozone will actually pass over one of your cells to kill a bacteria or parasite on the other side. We take full advantage of this for our patients in our office. Other infectious areas of the head and neck we safely treat with ozone include infected sinuses, infected tonsils, infected ears, and we use ozone to get rid of TMJ joint pain, tooth pain, and headaches, all naturally with oxygen therapy. When ozone is introduced into the blood, it has a myriad of different health benefits if used correctly. I cannot stress enough that ozone can be harmful if used at the wrong dose, if too much is given, or if the patient has been chronically ill for a long time and their immune system is shot. There are also different generators out on the market that aren't really good ozone generators. The quality of your oxygen and the quality of how the machine makes ozone are all very, very, very important parts of how you can use ozone safely. We use a Longevity Resources ozone generator because it's an FDA approved generator. I know about the quality of how it was manufactured and the strict research that's gone into measuring the dosing and what kind of ozone it's producing. So I feel very comfortable and confident using a Longevity Resource generator. People should not just start using ozone, start heavy ozone programs when they've had chronic health problems. Ozone can definitely help, but shouldn't always be the starting vehicle. Occasionally, it's important for people to be supplemented before they start ozone therapies with things like selenium or zinc or copper so that the proper reactions can run when you have ozone. The best way to use ozone in these circumstances is to go low and slow. I've literally seen hundreds of chronically ill patients regain their vitality and health with the use of ozone. It's actually a lot of fun. In my office, we use ozone with everything because it naturally improves all of our patient outcomes. I can't imagine practicing dentistry without ozone given all the benefits it offers to our patients. Ozone also just makes people feel better, and I like making people feel better.